following. 2 participants are in the conference.
AV rep.
Supervisor Johnson.
Okay, I'd like to call this meeting to order. This is April the 8th, and this will be a discussion, a possible action, reference, and update on the County Public Health Director to the Board of Supervisors regarding recent issues, actions, events, and county responses regarding the COVID-19 updates and any necessary actions based upon the updates. Madam Clerk, could you do a roll call, please?
Supervisor Johnson?
Present.
Supervisor Gould? Supervisor Angus? Supervisor Watson?
Present, thank you.
Chairman Bishop, we do have a quorum. We are missing 2 supervisors at this time, but we do have a quorum.
All right, very good. At this time, I'd like to turn the floor over to Denise Burley, our Public Health Director. If you could just start out by giving us a brief overview.
Certainly. Madam Chair, members of the board, I wanted to give you a brief overview of our progress so far. We are at 24 cases. Okay. And we have been tracking each of these cases, doing our contact investigations for each one. At this point, along with that, we are also updating our website on a regular basis, sometimes multiple times in a day. And just so that people are
Ron Gould
has joined the conference.
The website, if you open it up and you leave it open and then you walk away for a period of time and we update it, you have to actually refresh the page to get the more updated information. We realize some people have left that page open to go back to and refer to, and then, but that's the process of how the computer system works. So they do have to go back in and click refresh, and that page will update with the new information. At this time, we're meeting with our community partners on Mondays, Wednesdays, and Fridays at 1 o'clock. The agenda for those meetings I wanted to provide to you just as an overview. It's rather fluid, but we do have some very typical agenda items to share. We talk about hospital capacity, which I believe you receive information from us daily now on that, and it's basically the census, number of ventilators, number of beds, ICU beds, et cetera. So you've got that information now coming to you daily for the 4 hospitals in our county. We talk a little bit about personal protective equipment. As you know, PPE is a major concern among most agencies throughout the county, and whether or not we have sufficient supply. We have been using our strategic national stockpile products that we've received from the state, and we've pushed all of that out into the community because that's where it belongs, out in the community. So we'll continue to do that. Additionally, we've worked with several of the hospitals to purchase some additional PPE, masks particularly, to create a bigger, larger bulk order. And that hopefully will also assist those particular agencies with some of their concerns and use of equipment. We're also exploring the use of repurposing or sorry, I'm not going to get the terminology right. It's reusing N95 masks. There are hospitals and healthcare agencies in the state that are using methods to re-sterilize a mask and use that mask again. So we are researching those processes, and we'll provide that information out to hospitals and first responders specifically to make sure that they have that information on how that can be done. We're a little concerned with making recommendations, obviously, because there's some science behind it, but it's not a recommended practice. And so we're providing these agencies with that information, and they can choose to go what method they would like to use, if at all. But it will allow for that equipment to go further into the event. And we're really anticipating that this will Looking at the models, we're looking at towards the end of this month for it to peak here in our county. The prediction that Phoenix Fire made for the Phoenix metro area is that they'll peak around April 16th and a week thereafter. We tend to be lagging about a week behind that. So somewhere around there, but it's always sort of a guess. We see our numbers continue to go up, and that's, we just kind of base our decisions about that. The one thing I want to bring up about the Monday, Wednesday, Friday meetings, and I realize they can be very time-consuming, but I provided a model that I want to make sure is shared with all of you, and I'll place it right up here for the public's view. But public health is part of a much larger system, and that system, we're one piece of it, but we need all of these other community partners on the page with us in this response, which means communication. It means those agencies taking actions on their own behalf, and it means that we need to be working together as a team on both a unified response in addition to their own individual responses for their respective communities. So as you can see, I mean, it includes, of course, all the local jurisdictions, it's all the hospitals, it's community service agencies, EMS, first responders, it's community health centers, it's a big group of people. So in order for our department to be effective, in order for our community to be effective in addressing this situation, we need to all be working together to make that happen. So in order to keep people informed, in order to keep people to address issues and concerns and understand what those are and have that communication, that's why those meetings are so important. So we are currently also working on a quarantine and isolation site. This would be used for 3 specific populations if we want to use or be reimbursed for some of these services. So we just received information on public assistance for non-congregate sheltering delegation of authority. So that came yesterday. That actually requires that I submit an order to that effect that says that we're planning to open up a quarantine and isolation site. And we're right now trying to address the non-congregate piece because our plan was to move forward and may continue to move forward with the fairgrounds, which would be seen probably more as a congregate site. And I talked with Byron about this, and we have some questions to ask. What we're asking really is, what would the reimbursement be for this particular funding source to do this, and what would the cost be to change it to a non-congregate site, such as a motel or hotel? So those are all questions that we need to answer very quickly, because we would like to get at least a site up, potentially at the fairgrounds, as soon as possible, because the first case we have of a homeless person, for example, who has been diagnosed or suspect, we can't just release them out into the community. The hospital may not need to retain this person into the hospital. At the hospital, they may not be sick enough to stay, and so they need shelter. If we follow the guidance for this funding source, it would also be a site for healthcare and first responder individuals who have tested positive and need to stay away from their families or their work sites. And it would also be for homeless individual families. So as long as one person tested positive in that family, that would require that we bring them into this particular site. So we're exploring those options right now as well and trying to pursue those. Sorry, I have a pile of information I wanted to make sure I went through. And okay. We are working with the Arizona Department of Health Services, going back to the webpage. We noticed that there's a discrepancy between ADHS's website and our website. We're working on learning what that is. We both pull from the same systems, so we both should have the same numbers. So we're working on that issue. And I think that's what I have in a very, talk about Cliff Notes.
Okay, thank you very much. Supervisor Watson, do you have any
Toby Angus has joined the conference.
Okay. Supervisor Gold, do you have anything that you'd like to ask Denise?
Not at this time, Madam Chairman.
Okay, Supervisor Johnson?
Thank you, Madam Chair. Ms. Burley, you're saying that we're using the fairgrounds and possibly segregate people who have it to keep it away from their family, which makes sense, and I always thought made sense, but up until this point, we've just been seeing all the positive cases at home. What's the difference now?
Well, we realize that there are individuals that are homeless that we may find that we need to care for them, and we need a place to do so. And so that is a primary focus for us. But there's also the addition of this, especially for this particular funding source, which allows for us to serve healthcare providers and EMS first responders in that same category, in that same funding source. So we're looking at, we can expand that to them and to that group. We may also have individuals who are suspect or positive, and primarily we're focusing on positive, so just to be clear, we're focusing on that. But they may be living with a high-risk individual. And so going home would also, even at the best of circumstances, may put that high-risk individual at greater risk, knowing that there's a positive case in the household. So that may be another case that we would bring into this quarantine and isolation site.
Okay, we had some seniors that have already tested positive. We sent them home to their spouses, I guess, so it's a little confusing to me. The other thing you stated was you're thinking that we're going to peak out. Did you say next week?
It would be the week after. I think by the model that, and this is basing it on a Phoenix fire model at this point, okay? But they're assuming their peak is going to be about April 16th and last about a week. That puts us at about the 23rd, and our time frame has been about a week or so behind the Phoenix metro area as far as our case numbers rising.
With the discrepancies between the areas in positive cases, we don't think that ours will be a little different, because not that I'm wishing the worst on any other area, but with like Havasu having the highest number, I could see where we might peak out in 2 weeks if it spreads like that, but especially like in Bullhead, unless it's just an abnormality that they're not getting the cases, you think the same thing will happen there? They'll be in 2 weeks, or would that be longer?
Well, I wish I had a crystal ball to give that answer. I honestly do, because it would help us in our preparation and our steps moving forward, our planning. But, you know, I think on my part it would be pure speculation to give a guesstimate on that, and I apologize for not being more forthcoming there. I'm not trying to hide behind the question, just I'm not sure how to answer it at this point. I mean, we're watching the trends, and we have those tracked, and I believe you receive information now daily so that you can kind of see case counts by week and some of that information. So hopefully that's helpful for you to sort of see the trajectory of this disease in our county.
I understand that, and we appreciate the updates that you send us. It just seems to me if we're using the model from Phoenix, I don't know that, because they're all kind of connected in one area to the next, where we have, 40 or 60 miles between our communities. It could see a downturn in Havasu, but then an upturn in, the Bullhead area or the Kingman area. And if I just don't want to put out that, we're looking in 2 weeks from now, it's going to be going down and everybody's going to be safe.
Right.
But that was just my concern. Thank you. Those are the only questions I have, Madam Chair.
And I appreciate that point of view, Supervisor Johnson, because that very well could be the case. And we don't want to give anybody the impression that we need to change our practices based on what we just see in terms of trends, because it's really kind of what we have in reality that we're focused on.
Okay, Supervisor Angus, do you have any questions of Denise?
Well, I came late to the conference because I was given the wrong number, so I was holding on. So I will I'll follow up after this.
Okay, I believe this is being video recorded, so you'll be able to watch that video and then contact Denise directly.
Thank you.
Okay, there being no further questions? Denise, do you have anything in closing?
I don't. I just want to make sure everybody knows they can contact me at any point if you do have questions specific to anything in your district or throughout the county.
Okay, then we are adjourned. Thank you very much.
Thank you.